So today we'll be discussing the different type of ultrasound that is actually done during pregnancy, meaning different kind of scan done during your pregnancy. So today's discussion is basically for our antenatal mothers and our mothers to be. So the first on the list is what we call the dating scan. The dating scan is to date down to your pregnancy to be sure the pregnancy is intrauterine, meaning it is in the womb and not outside the womb, and also to check the fetal heartbeats. This is normally done between 6 weeks to 8 weeks. We have what we call the nuchal translucency scan. This is normally done to rule out chromosomal abnormalities such as the Down syndrome, the Patwa syndrome, and so much more. Then we have what we call, that is normally done between 8 weeks to 11 weeks. So we have what we call the anomaly scan, which is done to check for structural abnormalities in the baby, ranging from abnormalities in the brain, in the limbs, in the head, anywhere in the body to be sure there's no abnormalities in the baby whatsoever. That is done between the 18 weeks to 24 weeks. Then we have what we call the growth scan. The growth scan can be done anytime between the second to third trimester to be sure that baby is growing well. It estimates the weight of the baby along with the amniotic fluid to be sure the weight of the baby corresponds with the gestational age. Then we have what we call the fetal echocardiography. This check the fetal heart to check for abnormalities in the heart, structural abnormalities in the heart, to check the rate and be sure the heart is doing very well. Then finally we have the Doppler studies, which is used to check for blood flow from the amniotic fluid, to check the blood flow from the baby cord to the baby blood, especially when there's a query concerning the weight of the baby, or maybe the way baby is not growing as scheduled. The Doppler scan is a very important tool to note what is happening in there. So with all this, you can agree with me, there are so many scans that can be done during your pregnancy, not just to your routine antenatal scan, but so many things to check for during pregnancy. So make sure you go for your antenatal scan anytime you're scheduled for it by your medical professional. I remain yours sincerely, Major Franca. Thank you.